Haven al mundo.
Welcome to ¿Qué pasa? You're listening to us via WNHH 103.5 FM, here live in our studio audience. And you can also listen to us via the New Haven Independent.org and LaVozRadioTV.com. This is Norma Rodríguez-Reyes, your host. Here live in our studio audience, we have with us Dr. Hamed Ghorbani-Mohaddam. Dr. Hamed Ghorbani-Mohaddam. All of the H's are silent. And he is the owner and president of MGM Family Dental, and it's located at 2690 East Main Street in Bridgeport, Connecticut. He's a graduate of UCLA. He did his internship in Montefiore Hospital of Albert Einstein College of Medicine and also UConn Health Center. And so he hails originally to us from various different places, which I'll have an opportunity to tell us where he does. But he is a family dental, and he runs for all families regardless of age, from basically one age till 120 years old. So anyone that needs a dentist, he's the perfect dentist for you. Dr. Hamed, thank you so much for being with us today.
Thank you so much for having me today.
Yes. Doctor, tell us, where do you hail from and why Bridgeport?
Well, Bridgeport is very important because there's a shortage of dentists and especially specialists. And we have very good, excellent dentists. We have board-certified diplomats. We have specialists who teach at Harvard, graduate from Harvard. They have double doctorate degrees. We have specialists who are very skilled and provide services both in Bridgeport and Manhattan, and also they get a lot of referrals from the United States Armed Forces, the military, and the VA. So we have very, very skilled dentists. We also have our own dental laboratory on site, so we can provide a lot of services through our dental laboratories as well.
Thank you so much. Doctor, tell us, at what age should someone consider should go visit a dentist?
I believe as soon as possible. I mean, ideally, as soon as 1 year of age, because a lot of problems can be addressed, a lot of dental problems can be addressed via preventative measures. And a lot of problems that can become bigger problems, much bigger problems later in the future, can be addressed at early stage, so that the big, expensive, non-ideal solutions are prevented in the future.
Yes. And that why should anyone visit a dentist?
It's very important because the oral cavity in the mouth and the teeth are connected to the rest of our body. So if you have infection, and I've had a lot of patients who've had infections around the roots of their teeth for a long time, and they felt that it was a sinus problem, they felt that they had some other illnesses. They've been to a lot of medical doctors who couldn't figure out what the problem was, and they've been suffering, and all of a sudden they come in to our practice. We take images with our latest pan and Ceph machines and machines that can allow us see layers and layers of images into the bone, and we can figure out the problem and get them out of the pain and the misery they've had for a long time with no solutions.
And tell me, how long can a tooth last?
A tooth can last a very long time, as long as you take care of it. So if you see your dentist on a regular basis, if you prevent problems early on, they can last for a very long time.
So what are some of the ways in which one can prevent the tooth so that it can last you for a long, long time?
Number one is being on top of your oral hygiene, meaning that after every time you eat something, you have to floss, you have to keep the areas in between your teeth clean. Number two, you have to brush your teeth at least twice a day. Once before bedtime, because that's when we are most inactive and bacteria do the most damage, and once in the morning after major meal. So if the major meal in the morning is breakfast, then after breakfast. If it's lunch, then it's after lunch. And also very important, seeing your dentist on a regular basis, because there are certain things that your dentist can see and prevent that that patients may not be able to do that, or may not be able to see the problem early on. So if your dentist sees the problems and addresses them early on, bigger problems are prevented in the future.
Definitely. Now, because dentists are pretty expensive. So how can people pay for them? Like, do you accept all the different insurances, or?
We accept the majority of insurances. We have a lot of patients who have private insurance. We have a lot of patients who have Husky insurance. So that's not a problem at all. And people who have no insurance, we have provided, even for emergencies or just the regular checkups, if there are new patients to our practice, we have provided free examination, free x-rays, and even free cleaning. So we have made ourselves available to diagnose, to treatment plan, and they're not obligated to do anything with us. So we can look at the problem, we can do our examination, we can provide the cleaning for people who have no insurance and are new patients to our practice, so that they at least know what the problems are, so that they can address them however way they want to. They're not obligated again to do anything with us, but at least I feel that that's a very important thing that we can do. I mean, when I was a kid myself, or as I was growing up and going through college and dental school, the number one problem for me was, how much is this going to cost me to go see a doctor or a dentist, just so that I could figure out if there are any problems to be addressed. And a lot of times just the thought of having that expense prevented me from seeing a dentist or a doctor. So I don't want that to be a factor for our patients.
Good. So they do the free examination, the x-ray, and the cleaning, right?
Yes.
And then after you provide those free services, along with education, and what else happens after they get these free services? We
show the problems on the x-ray. Mm-hmm. We have, big screen TVs. We can show them on big screen TVs. We can show it on, with our latest imagery machines. We show them what the problems are. We treatment plan it. We tell them what are the alternative solutions, pros and cons. We explain what are the good ways to address it, what are the acceptable ways to address the problem. And then we break down the costs and we work with the finances. Sometimes we finance it in-house, meaning that the patient can pay us over time, with monthly installments. Sometimes, it's through a financial company that they provide no interest financing options for the patient. But we work with patients, and we do our best to make sure that we make it as affordable as they can possibly be.
Okay. Now tell us about the dentures, your denture program that you have available. Now, dentures are basically what a lot of people call false teeth, right?
Correct.
That they come on and off.
In some cases, yes, and you can also anchor them to implants, in which case you can anchor them on. So it's a better way of, a little bit more expensive, it's a better way of having dentures.
And you have, you mentioned your laboratory. Can you tell us a little bit more about the laboratory?
We have added a lot of new machines to our laboratories. We have basically 2 sites in our dental clinic that does a laboratory work for us. So a lot of the dental work or dental laboratory work are done on site, and a lot of practices don't have that option or don't provide that as an option to their patients, but we have that, and we have added the latest machineries and the best that is out there. We've added to our labs so that patients can be taken care of.
Okay, so then if someone also needs a set of dentures, do the insurance companies pay for that, or do they have to pay for that out of pocket?
That depends on their insurance. There are some insurances that say that you can have a denture every so many years, or maybe a couple of, or once every 2 years, or once every 7 years, or once every year. It really depends on the insurance. There are some insurances that say that if they've paid for one set, in the past, they're not going to pay for it again. But majority of insurances, they either pay 50% or they pay 100% for dentures. And in cases that the insurances don't pay for dentures, we have really made it very affordable for our patients to get their dentures through our laboratory. And we have been able to bring the cost down, again, depending on the design that they choose. We have been able to bring the cost down because we do a lot of our dental work or dental laboratory work on site.
Yes. So, doctor, tell me, there's so many dentists out there. Why choose MGM Family Dental?
Number one is that our dentists are very skilled and highly trained. As I mentioned to you, our orthodontist, for example, is Harvard trained, teaches at Harvard. When she took, some years ago, when she took the written part of the board, she was in the top 5 in the country. Some of her work is published in orthodontic magazines, as Case of the Month. She has a doctorate degree not only in the area of orthodontics, but DMSc or equivalent of PhD or doctorate in research in the area of orthodontics and bone regeneration. Again, the endodontist is also very highly trained, has gone to very prestigious programs, got into UCLA, which is one of the very best dental programs in the country, with a Dean Scholarship, and then went on to do residencies at UConn Health Center and Montefiore Hospitals of Albert Einstein College of Medicine, and a lot of other doctors that are there that are very highly trained and very highly skilled. And again, United States Armed Forces and military and the VA have referred a lot of cases to us. The cases that they couldn't finish or they were not able to do, they have sent those cases to us. We get a lot of referrals to our specialists from outside dentists. And on top of that, we do our whole model is to make ourselves available for patients. So if patients want to come in early in the morning, we are open to that. If they want to come to us late at night, even after our closing hours, we make ourselves available for them. If they want to come on a Saturday or a Sunday, we accommodate for that. So we are very available to help patients. We have saved a lot of teeth that could not be saved or other dentists deemed unsavable, and we have been able to save those teeth. I personally have extracted a lot of teeth that were deemed non-restorable, fixed them outside the mouth, and put it back in. I can count probably 40, maybe 50 cases of those, last year that I did personally do that. And again, we also provide free examination, free x-rays, free cleaning for new patients that have no insurance. We provide very competitive rates that have made a lot of dental work affordable for our patients. So those are the services that we have provided, and that's how we have flourished in the practice.
So tell us, what is an orthodontist and an endodontist?
So orthodontist addresses problems with alignment of the teeth. So if teeth are not aligned properly, sometimes that leads into periodontal problems, which leads to loss of bone. If teeth are not aligned properly, that can create open bite, which creates a lot of breathing problems or sleep problems. Some of the other things that they can address is they can look at the TMJ. If they have the right training, they can look at the TMJ. They can look at the sleep apnea devices to help with that. If you don't have the proper bite, it can lead to a lot of dental problems as well. So in addition to the aesthetic aspect of it, meaning that if you have a beautiful smile, then it makes a huge difference.
Yes, a smile speaks 1,000 words.
Right.
In terms of the orthodontists, those are the ones that do the braces?
They do.
So do you also provide that kind of service?
Right. Braces, clear braces, ceramic braces, Invisalign options, meaning that, a set of trays are provided to the patients that they put on, every 10 days or every couple of weeks until the teeth are aligned. We have done lingual braces, so that we make the braces invisible by putting them behind the teeth rather than in front of their teeth, so that it doesn't interfere
My
with
goodness,
their
I never
smile.
realized there were so many options.
Right. So the options are limited, and one of the reasons that the options are unlimited is because we have very good, highly skilled orthodontists who can provide that.
Because I always see them offering Invisalign. I just didn't know what Invisalign meant.
Invisalign are basically those trays that are made. So we take impressions, and then the trays are made, and those trays are computerized or programmed in such a way that they anticipate what the teeth will look like 10 days after you start wearing that particular tray, and then the second tray is adjusted to that. So as you keep on wearing these trays, your teeth are lined up to the correct position.
So the braces...
There are no braces in the Invisalign option.
So what
These
is
are
it?
just trays that you put on your teeth.
Trays?
Yes.
So
Like a mouth guard kind of a thing.
Okay.
Just like a mouth guard, but it's not a mouth guard. These are trays or materials that you put on your teeth that are removable. So you can put it in. When you want to eat something, you take it out, you eat, you floss, you brush your teeth, and then you put it back on. And after a while, it lines up your teeth in the proper way.
Wow, that really beats the braces. Because, a lot of kids went through, a lot of
Yes.
problems, because, when they smile, everybody would see the braces. And so, they weren't happy growing up because
Correct.
of the braces.
So we have prevented that problem. Number one, or we have addressed that problem. Number one, via the Invisalign option, and the other option would be again through the lingual braces, where we hide the braces behind the teeth.
It's amazing. I didn't know that. Okay, and endodontist?
The endodontist addresses the root problems. So if you have deep cavities and they have extended, or the cavity has extended itself to the center of the tooth where the vasculature and the nerve is, and you have toothache, or your tooth is highly sensitive, and those types of scenarios, then you see an endodontist who can disinfect the tooth, who can clean up the inside of the tooth and fill the tooth from the bottom end of the roots all the way to the top. And if as a result of infection there's a cyst that's formed inside the bone and it's growing and eating away the bone, then an endodontist who is trained in the area of the surgery can also perform root surgeries, remove the abscess, and even graft the area with bone, so that just immediately after the surgery the area looks normal and fine, and that way the tooth is safe.
Do you guys also do implants?
Yes, we do implants as well. So implant is also a good option. If the tooth cannot be saved, then implant is an option as well.
Wow, that's amazing.
But our goal, our first priority, is to save
the
teeth,
tooth.
to a degree that's possible. And if the tooth is definitely not savable, then implant is definitely a good option.
Well, I just want to remind everyone that you have been listening to WNHH 103.5. This is Norma Rodríguez-Reyes, your host in Que Pasa, and we have with us live on our studio audience Dr. Hamed Ghorbani-Mohaddam. Que lindo. Doctor, the H is silent. It's not Mohaddam, Magadam. That's how you pronounce it. And it's very interesting because I asked him about, is that his mother and his father's last name? And he said no, that both of them are his father's last name. And in the Latin American countries, they usually do like, Norma, Iris, Rodriguez, Gonzalez, and the Rodriguez is the father's name, and Gonzalez is the mother's last name. And then as you get married, they get rid of the mother's last name and they add the husband's last name. So the mother's in one way or the other. That's one of the reasons why a lot of the Latinos always want to have a male son to carry the name.
Oh, I see.
Because in the Latino community, that is very very, very important to be able to carry the name, the last name. But, with the women's liberation movement, a lot of the women refused to change their last names, to their husband's last name. So they kept the name. And nowadays they're adding their names to their children. So it's an interesting concept how things have been evolving. But, Doctor, tell us the secret for us not to have to go visit you.
Again, preventative measures are really the secret. Especially once, if you have never been to a dentist, you have to see a dentist and get a good evaluation, because if there are pre-existing conditions, they grow regardless of how good you are with your oral hygiene. Now, if you have a deep cavity, no matter how many times you floss or brush, or whether your diet is filled with sugar or there's no sugar, it doesn't matter, because the second layer of the tooth, which is dentin, is highly organic matter, which is consumable and eatable by microbes. So once the microbes have access to the second layer of your tooth, the problem progresses and continues regardless of what you do and how you take care of your teeth. So the most important thing is see your dentist if you haven't. And if you've visited your dentist in the past, make sure you see your dentist on a regular basis. So if there is any problem, again, that can be addressed. It can be addressed quickly in the beginning stages of the problem, so that it doesn't become a costly problem. And on top of that, I can't emphasize enough the importance of flossing, because that's very, very important. The majority of the problems do happen just because people do not floss. And by flossing, I mean every time you eat something, you have to be able to floss. If you don't floss, then the damage does happen. And these microbes are so tiny, they're not visible with the naked eye. But once you floss and you see a little bit of the food that's visible by naked eye, that's good enough for millions and billions of bacteria. And that's all it takes for the damage to happen. So floss, brush, see your dentist on a regular basis, and that's the secret.
Thank you, doctor. Thank you so much. Well, folks, I just want to remind you once again, you're listening to Dr. Hamed Ghorbani-Mohaddam, and he's with MGM Family Dental, 2690 East Main Street in Bridgeport, Connecticut. And for anyone who would like some more information, you can call 203-612-6079. Doctor, thank you so much for being with us today.
Thank you so much for having me. Really appreciate it.
Well, until next time, this is Norma Rodríguez-Reyes. Thank you for listening. www.lavozhispanatv.com y a través de WNHH 103.5 FM en New Haven. También nos puedes escuchar a través de newhavenindependent.org y lavozradiotv.com. Esta es Norma Rodríguez-Reyes en el show ¿Qué pasa? Quiero dejarles saber que aquí en nuestro estudio ustedes pueden encontrar al doctor Hamed Ghorbani-Mohaddam. Doctor Hamed Ghorbani-Mohaddam, él es un dentista de MGM Family Dental, un dentista de la familia. Y está ubicado en el 2690 East Main Street en Bridgeport, Connecticut. Y si quieren más información sobre él un poquito más tarde, 203-612-6079. Aquí ustedes van a ser educados hoy sobre lo importante de tener un dentista en la familia. Desde la edad que tú naces hasta la edad de 120 años, que ojalá y todos nosotros lleguemos a esa edad en buena salud. Dr. Hamed, muchas gracias por estar con nosotros hoy. Thank you, doctor, for being with us today.
Thank you for having me. Gracias.
Okay. El doctor se graduó de la Universidad de UCLA y también él hizo su residencia en Montefiore Hospital de Albert Einstein Colegio de Medicina. También hizo otro internado en UConn Centro de Salud. Así que él viene a nosotros con muchas cualificaciones y él ha estado practicando dentista por los últimos 7 años. Dentista para la familia entera. Ok, doctor, dime, ¿a qué edad un niño debe de visitar un dentista? At what age should a child visit a dentist?
As early as possible, because prevention is the key to a good oral hygiene and oral healthcare.
Él dice que lo más temprano posible, porque prevención es la llave para tener una bella sonrisa. Okay, now, why should anyone visit a dentist for prevention purposes? ¿Por qué es que una persona debe de visitar un doctor para prevención?
Because there are a lot of problems that dentists can take care of and see, and once those problems are discovered and addressed early on, then the bigger expensive problems are prevented in the future.
Okay, porque hay muchos problemas que un dentista puede ver y si esos problemas antemano se asegura que uno se encargue de ello, entonces eso va a prevenir bastante en el futuro. Okay, elaborate a little bit more on what are some of those problems. Por favor, elabora un poquito más sobre cuáles son algunos de esos problemas que un dentista puede ver.
For example, if a decay has extended itself to the second layer of the tooth, which is organic and eatable by microbes, they progress on their own, regardless of what people do and how many times they floss and brush their teeth.
Okay. Por ejemplo, si la segunda tapa del diente, que es orgánica, ¿ok?, está abierta, entonces los microbios pueden entonces empezar a comerse ese diente y obviamente el diente se daña, ¿ok?
And that can be a huge problem because once the second layer is accessed, the speed at which the decay progresses and abscess happens and the infection ends up in the bone and the jawbone is very high.
Okay. Porque entonces cuando esa segunda capa está abierta, entonces los organismos empiezan a comerse y entonces eso causa problemas también al hueso de la quijada. Okay. And what else are some of the other things that dentists see beforehand?
The other problems that dentists can see, one can be related to the area of orthodontics or braces. Meaning that if your teeth are not lined up properly, that can lead to many problems, breathing problems, periodontal problems, having cavities in areas that you wouldn't have had if you had the proper alignment of your teeth.
Okay. Otra cosa que el dentista puede ver es si los dientes no están lineados perfectamente como deben de estar, porque eso entonces causa problemas con la respiración, problemas con caries que tienen y periodontal. What's periodontal?
Gum disease.
Oh, y problemas también con la ¿cómo se dice? La encía. Y esos son muchos de los problemas. Así que va a tener problemas con respiración, con la encía y tener caries. Y viendo a un dentista de antemano, él le puede dejar saber a ustedes cuál es el problema que uno tiene. Okay. Anything else to the reason?
The other issue that can be prevented is a problem where the microbes have collected themselves within the gum, inside the gum, and deep in the gum, and that leads to periodontal problem and loss of bone around the teeth. So if you see your dentist and they do deep cleaning for you, then you don't end up losing a lot of bone very quickly around your teeth, and that speed can be slowed down significantly with the right treatment.
Entonces, hablamos de la segunda capa cuando está abierta, que se entran muchos microbios, ¿ok? Entonces, que viene pasando es que los dientes se ponen más flojos y ese microbio empieza a comerse los huesos. Entonces, es por eso que se tiene que proveer limpieza profunda, para eliminar de que el hueso se le vaya gastando. Thank you, doctor, for those answers. Okay, how long can teeth last?
They can last a very long time as long as they're taken care of, meaning
Okay.
that the patients follow the instructions and see their dentist on a regular basis.
Okay. Yo le pregunté que cuánto tiempo puede un diente durar y él dice que el diente puede durar por muy largo tiempo, especialmente si se atienden los dientes y si ven a sus dentistas en una manera regular. Okay. So, what are some of the things that they need to do in order for that tooth to last them for a long time? ¿Qué es lo que la persona debe de hacer para que el diente le dure por muchos años?
So, number one, I can't emphasize enough that they have to floss their teeth or in between teeth every time they eat something. And number two, they have to brush their teeth. So those are the most important things that they have to do. And again, by also seeing their dentist on a regular basis, it can prevent a lot of problems. If they grind their teeth, then there are solutions for that. If they have bad alignment of teeth that lead to problems, there's a solution for that. So as long as they see their dentist on a regular basis, floss and brush, they will be in a very good shape.
Okay. Lo más importante es que se tienen que cepillar los dientes frecuentemente después de haber comido, ¿ok? Así que por el desayuno y también por la noche, porque en la noche es cuando más de la bacteria funciona. Y también tienen que hacerse floss, meterse el hilo entre medio de cada diente para sacar la comida que está metida entre cada uno de los dientes. Y si acaso, si ustedes se pasan mordiéndose los dientes, tú sabes, yendo de izquierda y derecha con sus dientes, que se llama grinding los dientes, y también si tiene sus dientes no están perfectamente alineados el uno con el otro. Todo eso son razones por la cual uno debe de estar viendo al dentista y la manera en la cual tú puedes salvar tus dientes, ¿ok? So why, given the fact that there's so many dentists, why choose MGM Family Dental? Dado de que hay tantos dentistas allá afuera, ¿por qué escoger a MGM Dentista de la Familia?
Number one, we do have bilingual staff, so they speak fluent English and Spanish. Number two, we make ourselves available early in the morning, late in the evening, on Saturdays and Sundays, so we can accommodate patients with any schedule that they have. And on top of that, we have very skilled doctors who teach at well-known universities such as Harvard, who have graduated from very well-known programs, so patients will really be taken care of at our office.
Okay. La mayor razón por la cual se debe de escoger a MGM Dental es porque tienen personas bilingües en su práctica. También tienen horas súper flexibles, ¿ok? En la cual tarde por la tarde, los sábados y domingos, temprano por la mañana. So, en una emergencia o cualquier cosa, están disponibles. Y además de eso, tienen doctores que son súper cualificados y también que se han graduado de la Universidad de Harvard. Ok, tell us about the free offer that you offer for people that don't have dental insurance. Por favor, déjanos saber qué es lo que están ofreciendo para personas que no tienen seguro de dentista.
So if patients don't have any dental insurance and there are new patients to our practice, we do provide free examination, free x-rays, and free cleaning, and they're not obligated to do anything with us. So we take imagery with the latest machines that we have in our practice. The treatment plan, we provide alternative options. And then if the patients decide to do any work with us, we are fine with that. Obviously, we have very good skilled dentists. If they choose to work with other dentists, it's fine. So the free examination and cleaning doesn't mean that they have to necessarily do any work with us.
Okay. Una de las razones por la cual ellos están ofreciendo gratis para personas que no tienen seguro examen, rayo X y limpieza, porque ahí entonces ellos tienen la oportunidad de ver lo que está sucediendo, les dejan saber cuáles son los tratamientos necesarios y las alternativas, y si desean hacer el servicio con ellos, bien, y si no, está bien también, pero lo importante es que visiten a un dentista. Tell us about dentures, okay? What are the different options available? For why should you get dentures? When is it that you decide to get dentures? And then what are the options available? Déjanos saber, por favor, de dentaduras, que en realidad son como le dicen, nuestra gente le dicen dientes postizos, ¿ok? O dientes que se pueden, caja de dientes. Así es que le dice que por favor nos deje saber sobre las diferentes variedades que hay y cuáles son las opciones disponibles.
There are various options for dentures. There are dentures that are made that have no metal clasp in them. So when you put or partial denture in, you don't see any metal parts. There are some cases that we can enforce the denture itself with tough metal to make it more durable. So options are really, nowadays there are many options, and we have examples. We can discuss with each patient what those options are. And each option obviously has some pros and cons. So we can sit down with patients and show them what are the options and which one is best for them.
Okay. Bueno, tienen bastantes diferentes opciones disponibles. Hay partes, por ejemplo, que no tienen ningún tipo de metal, que el metal no se tiene que ver, ¿ok? Y sobre todo las diferentes opciones disponibles se le da la ventaja de esa o la desventaja de esa. Okay. What are some of the options in terms of payment? If they decide?
We do have payment plans in-house. We offer payment plans through a third party that charges no interest, and there are other options as well. So it really depends on the patient's situation and the finances. We have provided both options for patients. And again, we have been able to cut down our costs in comparison to other dentists because we do a lot of dental work in-house in our own dental laboratories.
Sí. Ellos tienen diferentes planes de pago disponibles. Tienen, por ejemplo, de tercer partido que pagan, en la cual no cobran ningún tipo de interés, pero también ellos tienen, como ellos pueden utilizar otros diferentes métodos para no tener que ir a esto, se economiza bastante dinero, pero la verdad es que tienen diferentes planes y en todo caso, si no se puede, entonces ustedes pueden pagar mensualmente. Así que en términos de la finanza es bastante flexible. Okay, doctor, tell me how not to have to come to see you. ¿Cuál es el secreto de no tener que ir a un dentista?
Again, flossing is very important. After patients eat just about anything, they have to floss in between their teeth. That's number one problem that causes actually a lot of problems for a lot of patients. And number two is brushing at least twice a day, once before bedtime and once in the morning. And of course, you haven't been to your dentist. You have to go for a thorough checkup so that any problem that are pre-existing problems are prevented. In addition to that, the regular examination and checkup prevents a lot of problems that patients by themselves may not be able to detect.
Bueno, el secreto, si no quieren en realidad venir a visitar el dentista, aunque en realidad no lo hay, porque siempre va a tener que venir a visitar el dentista, pero el doctor le dice que lo importante es que se laven los dientes, se cepillen los dientes por lo menos 2 veces al día. Por la mañana después de comer y por la tarde, por la noche antes de acostarse a dormir, porque eso es cuando más microbios en realidad dañan los dientes. Y lo importante es ir donde un dentista para ver cuáles son lo que existe para tratar de prevenir. ¿Ok? Prevención es todo. Bueno, doctor, thank you so much for being here with us.
Thank you.
Is there anything else that you would like to add before we close the session?
Patients are more than welcome to come to our practice, come for a visit. If they want to see our facility and see what we provide and what we have done for a lot of other patients, what we can do for them, they are more than welcome to do that. And again, we go above and beyond to accommodate any patient based on their schedule. Early morning, late evening, 7 days a week. So we are available to help them out.
Okay. El doctor quiere dejarles saber que ustedes están más que disponibles, están invitados a sus oficinas para que ustedes la puedan ver desde antemano, y como se mencionó, las horas son sumamente flexibles, así que si pasan pueden llamarlo o pueden pasar por su oficina, que está ubicada en la 2690 de la East Main Street en Bridgeport, Connecticut, y el teléfono del doctor es 203-612-6079, y él se llama Dr. Hamed Ghorbani-Mohaddam. Dr. Hamed Ghorbani-Mohaddam. Gracias, doctor, por estar con nosotros hoy. Y hasta la próxima. Bueno, quiero darle las gracias a todos ustedes que nos han estado escuchando, y hasta la próxima. Y por favor, no se olvide, si no quieren en realidad gastar mucho dinero en un dentista, cepíllese los dientes por lo menos 2 veces al día. Hilo dental, ¿ok? Cada vez que terminan de comer, pero sí quieren o no quieren, tienen que visitar un dentista, y entre más temprano lo hagan, más tiempo duran sus dientes. Recuérdense que han estado escuchando a Norma Rodríguez-Reyes en ¿Qué pasa? Hasta la próxima.